On day one of the UK vaccination program, 2 NHS workers had allergic reactions to the jab. And in the US, the FDA has received a panel recommendation to approve the Pfizer vaccine for emergency use. Canada has authorized the Pfizer vaccine and has ordered enough to protect each Canadian 5 times. But for people in poor countries, only 1 in 10 can hope to receive a vaccine by the end of next year. Well, the UN Secretary General has warned of vaccine nationalism. Meanwhile, China's leading vaccines are moving forward with millions promised to countries globally, especially developing countries. But there have been accusations of vaccine diplomacy. So what will ensure poor countries access to vaccines, and what preparations and risks are needed to be assessed for successful vaccinations? To talk about these questions and more, I'm joined by Jose Ricardo Jr., CEO of Lead China, Dr. Alan Whiteside, OBE, CG Chair in Global Health Policy, and later by Dr. Zhu Huachen, Associate Professor at the State Key Laboratory of Emerging Infectious Diseases at the University of Hong Kong. That is our topic. This is Dialogue. I'm Zhou Yue. The United Kingdom is the first country to have rolled out the Pfizer COVID-19 vaccine. And on Tuesday, 2 NHS workers had allergic reactions after having that new jab. So Professor Stephen Powers, a medical director of the NHS in England, said in a BBC report that the reaction was common with new vaccines. But still, it is a new vaccine. People are worried. So Alan, is it normal to have allergic reactions to vaccines?
Absolutely. There'll always be some people who will have these reactions, and I think we should note that these were minor allergic reactions and there were only 2. Of course, people look at it and say new vaccine allergic reaction, but people will get allergic reactions with old vaccines as well. So I do not think it is anything to worry about.
But some social media users have made claims of serious negative health effects from the Pfizer vaccine. 6 people died during late-stage trials. It is being also clarified that 2 of them had been given the vaccine while the other 4 received a placebo. So one of the vaccine recipients even had a heart attack 62 days after a second dose. Of course, those are just isolated cases, but people are still worried. Are those vaccines really safe? Alan, what do you say to them?
I would say to them that so far, all the vaccines we are seeing are safe. They have to be very seriously trialed. I do think that it's wrong to try and attribute causality when there's just correlation. People die all the time. So somebody dying of a heart attack 62 days after receiving the vaccine, I find it very hard to make a case that the vaccine would be implicated in that death.
But the advisory board of the American supervisory body actually said it's not a unanimous approval. 4 of them still said no. What are their arguments?
I wouldn't know without looking at it. I think they are overly cautious. The process of approval of medicines is quite different in America, Canada, the United Kingdom and Europe. So they tend to err far more on the cautious side because, of course, they are also a far more litigious society.
And what are the possible negative health effects that needed to be guarded against? What are the worst scenarios for those vaccines who have passed FDA approval?
Well, I think the answer would be that they don't actually work, and that would be fairly catastrophic. But so far, we are seeing relatively high levels of efficacy, which means that people will be protected. So I don't see major negative consequences yet. But we also have to remember that we're only a year into the process of recognizing and dealing with this disease. So that requires us to be constantly monitoring and evaluating as we move forward.
Another question is how long it will keep working. How does the Pfizer vaccine work, and will it offer lasting protections? Of course, we don't have data yet on that.
I will have to answer you with your own words. We don't have data. We just simply don't know. The Pfizer vaccine, they're suggesting you have 2 shots 21 days apart, and hopefully that'll give protection for a year or longer. But we won't know that until we've gone through the process of seeing how long it's actually going to work. And the only way you gather information over time is to have the time to gather the information over.
And Ricardo, there are some Chinese pharmaceutical companies running trial tests in Brazil, I know. What is the Brazilians' attitude towards the vaccines, and the Chinese pharmaceutical companies are going well there with their testing?
Well, there is a successful relationship between Sinovac Life Science and also Instituto Butantan, which is a Brazilian institute. They signed a cooperation agreement and started the tests in July 2020. And these tests, they may be finalized, the efficiency rate results will be published on December 15th. So far, there are 2 main streams. The first one is the Brazilian federal government. The Brazilian federal government acquired from AstraZeneca Oxford vaccine 260 million doses, and expects to also acquire from Pfizer 70 million doses. On the other hand, there is one specific state out of 27 federal units, the state of São Paulo, which has Butantan Institute, which acquired from Sinovac 46 million doses. And the state of São Paulo, why I mention about this? Because it has a population of 46 million people out of 212 million people in Brazil, and is responsible for 1/3 of Brazilian GDP. And the state of São Paulo expects to start to use the vaccine in January 25th. This is the estimative, especially because Brazil is in a very serious situation. On December 10, yesterday, there were 769 deaths, in an average in the last 7 days of 642 deaths. It's almost 180,000 deaths that Brazil had so far since the COVID-19 outbreak.
So the Brazilians are actually having 3 options: AstraZeneca, also Pfizer, and the Chinese Sinovac. What is the rationale of having 3 different vaccines available at the same time?
Well, actually, it's not going to be available at the same time. They are running the tests. They are on phase 3. The state of São Paulo is expected to lead this vaccine, the coronavirus vaccine, that it's called a Sinovac. Why? Because they already received the goods from China, and they are starting to produce it. Now, they are going to just request the authorization by the Brazilian supervisory body called Anvisa, the National Health Surveillance Agency. So if everything goes well, São Paulo will start the vaccine immunization on January 25th. And the federal government expects to deliver to the Brazilian citizens the vaccines between February, March 2021.
What is the public's attitude towards the vaccines? Should it become mandatory? Are they willing to take the vaccines in droves in Brazil?
Yes, actually, in the first phase, the vaccine will be applied only for senior people, for military and health professionals. And then they're going to start delivering to the people under 60 or under 50 and so on. So the expectation is that there are several Brazilian citizens looking at this race and checking in which place the vaccine will be applied first. For example, as myself, I'm receiving several calls from relatives, friends, and business partners all over Brazil asking me about the situation of the vaccine in São Paulo state. Because if so, and if they are allowed, they're gonna be the vaccine tourism, which is called in Brazil, which means that people will move from other states to come to São Paulo to have this Sinovac vaccine. So far, nothing has been fixed yet, but expectation will be January 25th from São Paulo state and February, March from the Brazilian federal government. It's important to say that China and Brazil has a very good relationship, trade relationship. Since 2009, China is the biggest trading partner of Brazil. And China is helping Brazil to fight against the common enemy, that is COVID-19. So this is one of the sectors that China may assist Brazil. This is the health sector. But also, China can promote to Brazil several technologies in terms of artificial intelligence, drones, UV robots, and also robots to deliver food and do some inspections in hospitals. So there are several key areas in which China may cooperate with Brazil in terms of fighting against COVID-19.
But Alan, not every country has the same attitude towards vaccinations, and not all people in one country. Take Canada, for example. Not everybody welcomes it. Figures from Ledger ACS reveal that 52% of those aged between 25 to 34 see mandatory vaccination a human rights violation, and 17% refuse vaccination outright. And in America, there is also half of the population who have problems with taking vaccines. What is your thoughts on this, Alan?
Well, I'm going to speak from a very personal point of view. I grew up in Swaziland in southern Africa. When I was 6 years old, I had measles, which mutated into encephalitis, which is a life-threatening disease. Had I got measles, I wouldn't have got measles 5 years later, because vaccinations were rolled out. Vaccinations are a fundamental way to deliver public health, and I know that there are people out there, some of whom have reasonably good reason to object to this, but most of them, I'm afraid, I think are just a bit loopy, as we say in English. They react to this. So the question you ask me is, should we make it mandatory? And the answer is, it's very hard to make it mandatory in Western democracies. But what you can do is make it necessary to have a vaccine in order to engage in certain activities. So, for example, we could insist that you have to have a vaccination certificate before you come into the country or before you cross borders. We could insist that you have a vaccination before you enroll in school. And that is not common around the world, and that is about putting public health ahead of individual rights. And I think that that is appropriate in this setting.
We've also collected some views from social media users. Let's take a look at some of them. This Mr. Rizwan Sohei said, a humble request to my colleagues in healthcare. Please learn about COVID-19 vaccines and advocate those vaccines to your patients. But please do not mock and shame people who are reluctant to get it this time. There are so many unknowns. So, Alan, yes, people still have doubts about the vaccines because it is produced in such a short span of time. Normally, vaccines gets longer to produce, and some vaccines involve new technologies. But on the other hand, if not a large part of the population get vaccinated, the disease will still spread. There is a contradiction there.
That is correct. Yes, you're absolutely right. There is something of a contradiction. But what we need to recognize is that at the moment, most of the vaccines prevent people from getting sick as opposed to them getting infected or transmission. So vaccines are rapidly developing. The whole vaccine field is changing all the time. And I think, in a way, this interview that you're doing, the special dialogue that you're doing, which is so important, is appropriate today. But in about 2 months, the questions you would be posing would be different because we would know so much more.
Yeah.
My congratulations to the scientists who rolled this out. And let's include in that the 3 Chinese vaccines that have been developed with great speed.
And there is another thing, that is the allocation, because the People's Vaccine Alliance said rich countries have bought enough doses to immunize their population. For example, Canada ordered enough to protect each Canadian 5 times, but in 67 poor nations, just 1 in 10 people can hope to receive a vaccine if the logistics and the finance work well. So this is not an ideal world, but poor countries have a very worse chance to get vaccinations in time. Alan?
You're absolutely correct. Now, but we must put this into context, because the Canadians may have enough vaccine for 5 times their population. That's true, and we know that they have taken options on that. But then the question you have to ask is, how many of those people actually need the vaccines? Because as the vaccine is being rolled out, we're looking at specific groups. In England, we've started with the people who are over 80 years, who are most vulnerable to infection and consequent death. We're moving it on to the workers in the health service, and then we'll start bringing it down the age groups. A 25-year-old doesn't need to be vaccinated yet. Let's get to them in due course. It's the people for whom it will do the most good and offer the most protection who we should reach first of all. And that was what our Brazilian colleague also said in his intervention.
All right. Thank you, Alan. And Ricardo, let's pick up on that, because the allocation of vaccines is still on the minds of many. Who will get the shots first? Do they deserve to do that? Ricardo, what is the Brazilian government authority thinking about the allocation?
Well, there's a huge discussion in Brazil about being or not being mandatory. But actually, as my colleague already said, in the Western world, it's really hard to make things mandatory, and it's against our constitution to push the people in a mandatory way to apply the vaccine. But to my eyes, judging by my experience, I feel that the Brazilians are eager to receive the vaccine, but it will be a really tough challenge because we have a huge continent with some lack of infrastructure. Do not forget that 60% of the Brazilian transportation is by roads, by highways, which means that in terms of receiving vaccines, we're going to have this challenge of infrastructure, challenge of logistics, and also the financing, which you already mentioned. So there are 3 relevant aspects that must be considered. And if you think also not only about the vaccine, but also about the materials to apply the vaccine, the Brazilian industry already estimates that it shall take 7 months to produce 300 million syringes. Remember that we have 212 million people in Brazil, and mostly the vaccines, they need to be applied twice in 2 doses. So it's also a challenge for Brazil to make the vaccine application successful.
And we have Dr. Zhu on the line. Dr. Zhu, the Pfizer vaccine also have to be stored and shipped at very extreme conditions, -7 degrees Celsius. But there are 3 million people living in the developing world. They simply cannot afford to have that kind of logistics, stable electricity, refrigeration. So it basically means that they will not get access to the Pfizer vaccines.
Mm-hmm. Okay. So I think that we have different options for the vaccine candidates. For example, in China, currently, we have 5 different pathways of producing the vaccine candidates. So some of this DNA vaccine or the adenovirus-based vaccine or influenza-based vaccine, actually, they don't need this kind of very extreme conditions for the storage of the vaccine or the transportation. So we have other
I want
options.
to evaluate the progress and timetables for these different types of vaccines. For example, the mRNA vaccine by Pfizer and Moderna will probably soon get approval. But what about the Chinese vaccine, adrenal vaccine, and the inactivated viral vaccine? Will they have the same effects, and what are the market prospects for the other alternatives?
I think for the inactivated vaccine, we are actually at a very ready stage. You know that recently in the UAE, they have already announced the official register of the vaccine from the Sinopharm. And I think that I can expect that within this probably 1 or 2 weeks, there should be some new announcement or news from this company. So I think that in China, we have 5 vaccine candidates now in stage 3, the phase 3 clinical trial. So for the adenovirus vaccine and also the recombinant DNA vaccine and also inactivated vaccine, they should be pretty close now.
Actually, we have already have initial data. The vaccine you mentioned by Sinopharm has been registered in UAE. It says the vaccine was 86% effective in phase 3 trial, and analysis showed no safety concerns. 31,000 joined this trial beginning. So is it good news? But what about the production capacity of those inactivated vaccines from Sinopharm? Can they produce hundreds of millions in short span of time?
I think that in the past few months, experts from China has already been go all out to build up the capacity of the vaccine production in China. And I think currently, even just for the Sinopharm, they have already been capable to produce hundreds of millions of vaccines. I think in next year, they should be able to expand this kind of capacity to 1 billion doses per year. But now I think they should have already been ready for like 500 million doses. Yes.
And Ricardo, China also promised that we will helping those developing countries, including Southeast Asian nations and African nations. They will be first in line when Beijing's vaccines are ready to be distributed. But there are also countries who are saying this is vaccine diplomacy, China trying to win favors and political leverages in these countries. How do you look at this?
So first, I would say that we're living in this kind of global village. It is impossible for
Ricardo,
you to keep the virus.
Let Dr. Zhu finish first.
Yeah, sure. Okay.
Okay, Ricardo, your turn.
Honestly, the UN Secretary General already applied $4.2 billion for the next 2 months for the COVAX platform, which China also joined.
Yeah.
And it's also important to state that the Prime Minister Li Keqiang informed that China shall take practical steps to promote the affordability and availability of the vaccine. And the President of People's Republic of China, Mr. Xi Jinping, on November 17, 2020, during the 12th BRICS summit, highlighted 5 key important actions that had to be taken by the BRICS countries. And the first 2 is that we should uphold the multilateralism and safeguard peace and stability in the world. And the second one, that we need to enhance solidarity and coordination and come together to meet COVID-19 challenge. So China is playing an important role in the world to fight against this invisible enemy. This enemy has no origin. So I think that China is successfully helping not only the developing countries but also the developed countries in order to fight against COVID-19. In terms of the poor countries, China is not only donating individual equipments, but it's also providing medical assistance, sending doctors abroad in order to teach and to give better orientation for the health professionals, which are also fighting all over the world against the coronavirus.
And Dr. Zhu, there is another point earlier Alan pointed out. The vaccine should first go to those who are in desperate need. Here in China, actually COVID-19 has been contained. There is few new cases. So probably it makes sense for China to sell its vaccines to those developing countries, especially those who are still ravaged by COVID.
I agree. So I think that, as I just mentioned, that we're actually living in this kind of a global village. So we need to help people, even they are living in other countries. So you cannot imagine that you just keep yourself safe without allowing the virus getting across the border. So I think that it's important for the scientists to figure out the disease pattern and also make a disease modeling so that we can know who and where would need this kind of vaccines badly. So I think that would be that would need some cooperation between the different regions and countries so that people can figure out how to distribute this kind of vaccines in a very rational way.
Yeah. But China has already joined the COVAX program, as Ricardo mentioned, but the United States is not. But do you expect this kind of international coordination can happen without the participation of the U.S.?
I would say that we know that U.S. still being the leader for the science and technology in many aspects, they will be very welcome and greatly needed for this kind of global vaccine program. I think that probably the UN should play a more important role in coordinating this kind of cooperations. But I would say that since nowadays there are so many companies, they all put a lot of efforts in developing the vaccines and also trying to enhance the capacity in vaccine production. So even if the U.S., if they really don't want to participate, I think the other countries, if we join together, we still have the chance to combat the virus.
All right.
And the disease.
Thank you, Dr. Zhu, and thank you, Ricardo, for your analysis. And you've been watching Dialogue here on CGTN. I'm Zhou in Beijing. Thanks for watching. Goodbye.